There's three components of orthodontics. How are you going to make space to straighten the teeth? If there's crowding, if there's spacing, that's easy. You're just closing the space, but most people don't come in for that problem. Most people come in for crowding, and there's limitations to what the jaw or the bone will allow you to do. So that's part of the diagnosis. So that's the first part. How do you make space? Treatment planning, straightening the teeth. And then the last part that really gets underemphasized is keeping the teeth straight, since most people don't want to pay for this again. So we really emphasize retention and how the patients wear retainers. So one of the things I've always practiced from day one, the concept of wear your retainers all day is nonsense. That's just not necessary. So we only have patients wear retainers at night for the most part. But also we design retainers to be able to treat problems if they develop a year or two after the braces come off. So I don't mean to get too technical, but one problem we treat is if there's too much growth of the lower jaw. Well, we treat someone when they're 13 or 14 because it's socially the right time to do it, but especially for boys, a 14-year-old's going to keep growing till they're 17 or 18. So we design in the retainers capabilities to wear elastics with retainers. And that's our commitment to the patients, that until we know they're done growing, and then even to that extent, when we have a patient like that, we'll take x-rays once a year to monitor the growth so we know when the growth stops. So again, not all patients are created equal. Not every patient gets the same thing. Now, if you go to the clinics, and there's many different clinics in disguise, a clinic could be a clinic, it could be a private office that behaves like a clinic. You pay for a year of retention and then you're done. And then if you come back 2 years later and the jaw's grown, they'll just say, oh, we had no control, there was growth. Yeah, but we're trained to understand growth. We know what's going to happen. Part of that is, if you don't explain that to the parent, you're really shirking your responsibility, because there's a false expectation that, the teeth are not in cement, they're in bone, and the bone can grow. So, if you pay a little bit more, but you're getting 3 extra years or 4 extra years of monitoring, and the dedication to making sure that that result is a long-lasting result, is that worth it? Each individual has to make that decision for themselves. So, the key is to do your homework, understand it's not just about, not every brace, it's not a commodity. It's not a commodity. You're buying the individual and the integrity of that office. So I just implore the patients out there to be a good consumer and understand that this is an investment in your health and your future, and you just don't want to cut corners, because in the long run, you're not saving money, you're costing yourself time, money, and aggravation.